Hello, everybody. Thanks for having me. My name's Thomas. I'm here to tell you about SensVita. We're making next generation touchless sensors for continuous chronic illness monitoring. We're a National Science Foundation and Cornell backed company. And exciting news, we actually launched our first customer demo a week ago. So let's dive into it. So, the core problem we're trying to solve is that chronic illnesses are constant. They follow you when you're away from the hospital. So, we believe that monitoring should too. In the US, cardiopulmonary chronic illnesses alone cost $270 billion. That's not to mention that cardiac illnesses are the leading cause of death worldwide. This isn't a problem alone in humans. In canines, every dog has a 75% lifetime risk of heart failure. But if you talk to any vet or any physician, they'll tell you that this is treatable, this is preventable, but detection is the key bottleneck. So why does this not happen now? Well, traditional monitoring is inconvenient and inaccessible. It's locked away in a hospital that uninsured, rural people just don't have the chance to get to. You can get an implant, but these cost up to $50,000 and many patients resist them. Or you can have a wearable sensor that improves the invasiveness, but of course, these have low patient compliance. And here's a quote that we learned during our extensive customer discovery for this product, that after a year, only 20% of patients still use home monitoring tools. This renders the entire home monitoring program totally ineffective. So let's zoom out. What would be the perfect solution? Well, in that solution, monitoring would just happen. It'd be passive, it'd be continuous. Then we could use AI to tell you when something's going wrong and be proactive about your care rather than reactive. So this is the future that we're building here. And we're doing this with our patented technology called near-field radio frequency sensing. This is like a radar for your heart, but we don't need to touch your skin. What this lets us do is make both wearable devices and in-furniture devices that monitor key details about your heart and lung health. That way we can prevent hospitalizations and prevent bad outcomes before they occur. This is technology that's been developed for 8 years now. I need to update the slide. At Cornell University, I worked on it during my PhD, and I'm very excited to take it towards commercialization. So during a lot of customer discovery, we've identified some major opportunities, mainly in heart failure, both canine and human, in elder care, which is a rapidly growing need, and in warfighter monitoring in the defense industry. But we're focusing on heart failure. Canine heart failure is a huge problem. It affects 8 million dogs. There's actually more dogs than people with heart failure. And it costs over $2 billion in out-of-pocket costs. Then in human heart failure, there will be 8 million people with heart failure by 2030. And this costs the US over $30 billion. These are massive problems that we're aiming to solve. So our strategy, we're going to deploy our sensors in canine health first. That way we can iterate quickly. This is a non-regulated market to generate early revenue and low-cost validation. We'll then use all the data that we've had here to train better AI models to be more prepared for the FDA-regulated process. Phase one is our canine health market. This will start next year with a TAM, a respectable TAM on its own of $1.2 billion, and we'll leverage this learning to reach human heart failure by 2030. So let's zoom in, and I want to draw your attention to the right side. That's Marvin. He's our mascot. He's the best, and he was our test subject for our first demo product, where we're going to sell an AI-powered NFRF canine harness that at the point of diagnosis through veterinary clinics. This is a B to B to C model to the owners of dogs with chronic heart failure. So when your dog is diagnosed, you'll be sold a SensVita harness. The harness will then communicate with your vet and let them know when when a hospitalization may occur, so we can prevent it before an expensive emergency hospitalization happens. So we have a hardware plus software business model. We have a low price per low COGS, and the key value is that we're preventing $1,000 hospitalizations, and we're also preventing the difficult choice between an expensive vet bill and what to best do for your dog. The competition in this space, there are a library of devices out there that are like Fitbits for your dog, but we are the industry's only at-home heart failure specific monitoring device for vets. The key differentiator of our technology is we're monitoring the heart and lung volume itself. This is a core parameter that the cardiologists we talk to are very excited about, and nothing else comes close. And again, don't trust me. This is a quote from a veterinary cardiologist that we're preparing pilots with. That a device like SensVita's would be massive to help manage canine heart failure, and he can't wait to try it. In phase two, we'll reach a human heart failure market, where we'll sell a bed pad with our sensors embedded in it. That way, monitoring is passive. Patients just have to lay down at home to be monitored. We'll sell this to value-based care health systems to manage geriatric heart failure patients. These are the patients for whom wearable and implantables are least suited. And again, the core value we're providing this customer is reducing expensive heart failure readmissions, which can cost up to $20,000 per. We'd be the industry's first passive in-furniture heart failure monitoring device. This is a brand new paradigm that SensVita is pioneering. So who's going to do it? I've been developing this technology for over 6 years now. I've worked in non-invasive sensing for about 10 years. My co-founder, Jim, he has experience as the worldwide vice president of innovation engineering at Johnson & Johnson Vision. He scaled medical devices from 0 to Johnson & Johnson scale, so it's very helpful for us. And we have 2 great engineers with us right now, Gersamran and Jonathan, who are working on demos and the demos that we just launched. We also have a great advisory team with technical, business, and clinical cardiology expertise. Some of our traction, we have a National Science Foundation Phase 1 STTR grant, and we're supported by the Great Runway Startup Program, which is in that building right there. We have great partners in canine health already, including Cornell's veterinary school, and we have human health partners, including an active demo, like I mentioned. So we are SensVita. We're making the next generation of touchless sensors, and our goal is to save the lives of pets and patients. Thank you.
With your sensors, how does that, I mean, I think I understand, but I want you to clarify. How does that compare, like the reliability, accuracy with what the standard of care is today?
Yeah, so in all of our previous papers, we match accuracy of existing invasive methods. So what we're doing instead of a typical remote patient monitoring sensor for heart failure is like a patch. It would sit on you for about 30 days. And that's looking at your lung behavior, lung edema over time. We can monitor that same thing, and we've shown this in papers. We can monitor that same factors, but non-invasively with no skin contact. So the accuracy is really matched. We've been working on this for a long time, but in a much less invasive way, which gives us a new patient population we can use.
Are there different sizes of sensors based on the application? And is there a different cost factor that's going to apply to each of those applications?
That's a good question. So we have devices as small as the little one on Marvin here. This is just a little sensor on his chest. And then we have as big as a 4-foot sensor that goes underneath your bed sheets that you just lay down on, and it's printed on fabric, so you don't really feel it. So yeah, we can make it as big or as small as needed. But the cost, you're right. The bigger, it's a little more expensive, but the human market can support higher prices due to insurance reimbursement.
I loved your presentation. I want to try it with my dog. So for the software, is that feeding into like an app on my phone? Is it going to the doctor? Like how does the healthcare then come into?
So in the canine or human market, because they're slightly different.
Yeah, and let's talk about humans since we only have. Yeah.
So in the human market, we're targeting geriatric patients. So we can make an app, but it's not something we found a big need for. Typically, there's current remote patient monitoring that happens where they'll send a scale and some devices, and they get sent back totally unopened because patients aren't going to connect it to Bluetooth, connect it to Wi-Fi. That just doesn't happen. So that data will be processed, and what we'll give the doctor is insights. That's the key part, and that's why AI is so important here. Doctors don't want to read 8 hours extra data a day. They don't have that time. So we want to give them just the answer of, hey, this is getting worse. In the canine market, there's an app for the owners, but in the human market, not on the plan right now.
And is there any kind of like alarm or something like to alert the doctor?
Yeah,
like,
I think there will be
deteriorating?
alerts through the doctor, right? Like once we alert the doctor, they will send an alert, get in contact with the patient to intervene earlier. In heart failure, your first thing you're going to do is titrate different drugs. So you'll try and change drug doses unless it's very acute.
You mentioned that you just had your first customer. Congratulations. Do you have projections set for next year or this year?
Customer demo.
Demo.
Yeah.
Oh, sorry.
Did I say? I thought
No,
I said
you might have said demo. I
Okay.
might have just heard customer and got excited.
Okay. I'm still excited about the demo.
That is exciting.
So yeah, we do expect though, in the canine heart failure market, the reason we're going that route is because we can be in the market next year. So our goal for next year, we're raising $1 million seed round right now. Our goal is to acquire 10 vet clinics to be these B2B2C distributors by the end of next year.
You have a dollar figure associated with that?
I do, but I mean, I would need to relook at it. I don't want to try and remember right now.
Okay.
Yeah.
Thanks.
Thanks.